Hello, welcome to the first one of the two lectures on public policy in the state of Texas. Public policy refers to what a government does or doesn't do about an issue that the society is facing. So these issues could be education, poverty, drug problem, and similar other issues. And so public policies are created or not created in response to addressing these issues. And these policies, when they are created, are implemented by incentives or sanctions. These are there are two ways of implementing those, incentives or sanctions. So in other words, the policy could encourage people to behave in a way, or they simply punish them by not behaving in the desired way. One example of a public policy would be toll roads. So imagine that there's let's say the city of Austin has pretty congested traffic, especially in rush hour, and like most major cities in the United States. And so to fix that problem, the state officials, if it's a state-related matter, then they may go on to create toll roads, which are basically the government giving a contract to a private company to build and administer the road for a while, and charge people for every time they use it, and that would be the company's return from that investment. And so this is an alternative to the government itself creating the roads by using tax dollars. So advantages of toll roads is that it's fair because only those people who use the road end up paying for it. And also it fixes the problem, the congestion in traffic. However, the drawback is that it could be unaffordable for some people, because a much smaller part of the population who actually use this road would be paying for this road that is so expensive. So therefore they may have to pay a lot of money as a result, and the project may end up not serving its full desired purpose of reducing traffic. So our policymakers adopt policies through this multiple step process. The first step would be identifying the problem. So in our last example, it was the traffic problem in the city of Austin. The second step would be formulating a policy or a remedy to address this problem. So welfare support or work incentives or improving educational access would be some of the ideas or remedies that could be considered to address the problem of poverty, for example, when we discuss poverty as an issue. The third step would be implementing the policy. As I mentioned before, two instruments can be used here. Some policies are designed in such a way that they simply purely passively create an encouragement or an incentive for people to do them, or to behave the way that the policy wants them to behave. And in some other policies, it's the sanctions. There are some penalties for not behaving the desired way. So an example of the penalty type or the sanction type of policy implementation would be the Obamacare's penalty, which is around $695 for not having health insurance on any given month in a given tax year. So this is that program's way of encouraging people to adopt a policy. A fourth step in the policymaking process, evaluating the policy. So it's very important that the policymakers find some objective, usable and sustainable metrics to evaluate the performance of the policy in addressing the problem it's designed to address. So here, effectiveness as well as efficiency of the policy are being evaluated. Efficiency and effectiveness are two economic terms that are close to one another, but they are quite different from one another. Effectiveness simply refers to reaching the goal, and efficiency refers to increasing the outcome per resource use ratio. In other words, performing the same efficiency means either performing the same way by using less resources or using the same amount of resources but improving the outcome or productivity. So both efficiency and effectiveness are important when it comes to evaluating the policies in Texas. So when we look at the state of Texas, we see that there are four main categories that are very important public policy categories for the state: education, welfare or economics, healthcare, and abortion. In today's lecture, we'll discuss education and welfare. In the next one, healthcare and abortion will be discussed. When we look at the state of education in Texas, we see that there are a number of issues with it. First one is that the government spending per student is at a very low level. Texas, as I think we discussed in an earlier lecture last week, I believe, is one of the states that has the lowest per pupil spending in public education. And this is definitely a major problem facing the state's education system. Secondly, more than half of the students in Texas are of Hispanic origin, and some of them, which statistically are 18%, roughly about 1 out of every 5, speaks Spanish as the primary language and English as a secondary language, and their English, they do not self-identify their English level as sufficient. So they don't feel as comfortable in English as they do with Spanish. So as a result, the education system that's designed for English curriculums have been struggling to address the needs of these students, which are not negligible in numbers. The third problem facing the education system in Texas is the income level. 60% of all students in public education in Texas are lower income students, and half of them are at risk. Which makes them more likely to fail in their classes or drop out. And a fifth problem is that the property tax funded schools disallow these lower income students to get a better education. Because when property taxes are the main source of revenues for public schools, then those students who live in lower income neighborhoods would naturally be able to go to schools that are underfunded or funded less than the others, and as a result, their educational opportunities would remain limited. So some of the ideas that our policymakers came up with to address these problems are these. First and foremost, vouchers have been a much debated but very strongly used instruments. So vouchers refer to parents being able to leave underperforming public schools for better public or charter or even private schools, and be able to use their government vouchers in those educations, in those schools. So this voucher system kind of spreads the opportunities for lower income students' parents. A second idea has been the charter schools. For the last 30 years or so, charter schools have been spreading more and more. And these are a unique type of educational institutions that are like a crossbreed between a public school and a private school. They are funded by the government, but they are administered by private foundations, nonprofit foundations. So it's argued that it would create some dynamism and some competition because these schools have to perform well in order to continue to receive the government fund for their operations. But at the same time, critics of these schools argue that this system encourages these schools to be overly test-oriented, and education may suffer as a result. One other idea that's discussed, if not as loudly, is increase in teacher salaries. Unfortunately, teacher salaries overall are lower than what they should be in the entire country, United States. But Texas, this situation is even worse when compared to other states. Texas's average teacher salary is significantly lower compared to other states, comparable states with similar average GDP level or average state income level. And Finland Phenomenon is a very interesting documentary where where you can see here. I'll post a link to it. In it, a Harvard education professor finds out something very interesting. He finds out that Finland actually does everything when it comes to education. That's the opposite of what we're doing in the United States. So they have minimal testing, they have very little class time, and almost no homeworks, and etc. Yet they consistently rank to be the best education system in the world. So in this country, in Northeastern Europe, attracts the attention of this Harvard professor in education department. He hops on the plane, goes there and interviews a bunch of people, including their education minister, teachers, students, and parents, and principals, etc. And his findings are quite instructive. They are very, very interesting. I strongly suggest you check out this video. But are relevant to our discussion here is that one of the many things that he finds Finland doing different is that their teachers are very highly respected and highly compensated professionals. It takes very long years and very difficult educations to become a teacher there, and they also get paid quite highly. They're almost like college professors in terms of their social status and income and all. So poverty or economic opportunities in the state of Texas, the problem is identified as this. 15% of Texas population are enrolled in Medicaid, which is a federal program created for the people of financially disadvantaged backgrounds to help out with their medical expenses, and so they have inability. They are not able to satisfy their basic needs of food, shelter, clothing, and transportation in a sustainable fashion. So poverty is a major, serious problem in the state of Texas. So some of the ideas that have been created to address this problem in the years between 1960 and 90. Welfare programs were considered to be the remedy. A number of programs provided cash support and other support like tax advantages to low-income families in order to support them. But starting from 1990s, this position is reversed. The argument was that welfare actually creates dependency. It incentivizes individuals to not try hard enough and depend on the government to sustain their lives. So it's what economists call a perverse incentive. It's an incentive that incentivizes the person for the opposite of what you'd like to do. So as a result, the argument is that the dependency translates into more population. For instance, every family having more babies, because every time they make a baby, they would have an additional income coming their way, and therefore it worsens the problem that it seeks to fix, because we try to reduce the lower income population, not increase it in the state.